Good afternoon. I'm Travis Gayles, and I'm your County Health Officer. And in the midst of busy times, I wanted to take some time out to give you some updates and to address any questions that you have about how we're moving forward in addressing COVID-19 in the county. There are a couple areas in particular I wanted to highlight before engaging in conversation and questions. One, I wanted to talk about testing recommendations and availability. Also, the notion of we've seen triage tents pop up at the hospitals, and what are they exactly, and what does that mean in terms of our response, as well as provide an update in terms of the number of residents in Montgomery County who are impacted by COVID-19. So to start off with the numbers, the most recent numbers of residents of Maryland who have tested positive for COVID-19. At this point, we have 107 diagnosed cases. And 33 of those cases are residents of Montgomery County. We saw overnight our first COVID-related fatality in Prince George's County, and we have seen our first diagnosis of a child with COVID-19, a 5-year-old in Howard County. The majority of our cases, in fact, all of our cases within the county, all 33, are over the age of 18, and we've not seen any school-age children impacted just yet. In terms of diagnoses. One thing I also want to highlight is when we talk about the triage tents. Some of you may have heard that at each of our hospital campuses across the county, tents are being put up outside of emergency rooms. What these tents are being used for are to triage and screen patients who may have symptoms concerning for COVID-19, to help be able to triage them quicker and faster, and keep them out of the emergency room setting as to not potentially expose others in the hospital to those symptoms without the necessary proper protective equipment. After individuals are triaged and screened through the tents, if they need an escalation of care, then they are escorted and seen in the emergency room with protective equipment. The other thing I wanted to talk about is I recognize there's a lot of anxiety around testing recommendations and testing capacity. I want to make sure that folks at home understand that testing right now is being reserved for individuals who are symptomatic, have concerning clinical presentations and histories concerning for COVID-19. Testing is not being done on a general public level at this point. And the other thing is that the testing recommendations are no longer tied to travel history alone. Originally, testing recommendations and criteria related to travel history to certain areas across the globe. Now that we have seen evidence of community transmission in our communities, those testing criteria are tied more to clinical presentation, particularly if an individual, even with a negative travel history, is presenting with clinical symptoms that cannot be explained by other diagnoses such as flu, since it is, after all, still flu season, allergies with the adjunct of allergy season, and any other type of respiratory illness that could explain those respiratory-related symptoms. So those are some overarching things I wanted to put out there and address because we know that there have been some concerns expressed through the different media and wanted to make sure that we proactively put information out to address those concerns. Lastly, before getting into more specific questions, want to again uplift the concerns and anxiety in the community. We hear you, we feel your frustrations, particularly around testing availability and capacity. But I want you to continue to rest assured that we are continuing to work hard and leverage as many resources as we have and continue to explore other ideas and alternative strategies to address your concerns, such as increasing availability and access to testing outside of emergency room settings and primary care settings. So we're working hard to address those concerns and continue to come up with innovative strategies to protect you, the residents of Montgomery County.